everyone! So today I am going to be talking about Ehlers-Danlos Syndrome or EDS. As you can see, I have a guest star here today. She is 13 years old and she's getting a little hard of hearing, so she likes to bark at everything. By the time this video goes up, it's probably going to be February, but right now my room is very messy and hectic since I'm getting ready to go back to my apartment in a few days. So I'm just going to go right into talking about Ehlers-Danlos Syndrome. Ehlers-Danlos Syndrome is a connective tissue disorder that can be inherited. More specifically, it is a disorder in collagen, which is a specific type of connective tissue. Because collagen is made differently in people with Ehlers-Danlos syndrome, it can cause the collagen to act in a different way. And this is a huge issue because collagen and connective tissue is everywhere in your body, holding all of your different types of tissues together. According to the Ehlers-Danlos Society, there are 13 different subtypes of EDS, and each subtype has different symptoms associated with them, which require different treatments. These subtypes also have different severities, and it's presented differently in each person. A few of the subtypes of EDS on the website include vascular EDS, or VEDS, classical EDS, or hypermobile. I can never pronounce this, even though this is the one I have. Hypermobile Ehlers-Danlos Syndrome, or hEDS, which is much easier to say. hEDS is also the most common subtype of Ehlers-Danlos Syndrome. Right now, I am reading a book called Disjointed, Navigating the Diagnosis and Management of Hypermobile Ehlers-Danlos Syndrome and Hypermobility Spectrum Disorders, which is by Jovin. I hope I'm not butchering that name. This book has so much information about hEDS in it. And if you want to learn more about hEDS, I recommend that you read it. Despite the differences in each of the subtypes of EDS, there are some symptoms that overlap. According to the Ehlers-Danlos Society, the general symptoms include joint hypermobility, skin hyperextensibility, and fragile tissue. I didn't know that my joints were necessarily flexible for a long time. One of the nurses at my GI specialist's office asked me if I could bend my thumb to my wrist. I thought that was a strange question, and just go like this and bend it all the way back. I didn't know that I could do that, and I also didn't know that wasn't normal. So she was actually the one that suggested that we go see a geneticist to talk about Ehlers-Danlos syndrome, since that can be linked to gastroparesis. Which also brings me to my next point. People with Ehlers-Danlos syndrome often have comorbidities. I know comorbidity sounds very morbid, I guess, but it's not that serious. It's just talking about other chronic issues that go along with something else. Some of the comorbidities that can go along with EDS include gastrointestinal morbidities such as gastroparesis or IBS, autonomic disorders that include high heart rate, temperature intolerance, and differences in blood pressure. EDS can also lead to inflammatory issues and disorders such as mast cell activation syndrome, or MCAS. To be diagnosed with Ehlers-Danlos syndrome, you typically go to a geneticist. When you see the geneticist, you talk about your past history and your family medical history as well. You also perform certain evaluations to test joint hypermobility along with any other of the general symptoms that go along with EDS. There's quite a bit of criteria involved in the diagnosis of EDS, but I'm not going to go into that right now. hEDS is the subtype that does not have an exact genetic origin. We know that hEDS is able to be passed on from generation to generation, but we're not exactly sure what that gene is or what the process is exactly. Some of the other subtypes of EDS can be found with genetic testing. This diagnostic process for people with EDS is often very long and difficult. Most of this is due to the reason that EDS is not widely known. Most of my doctors that I have don't know about EDS, so I have to educate them myself about what it is and what it means for me specifically, and sort of whatever treatments that they want to talk about. There's also a lot of stigma around people with EDS because a lot of doctors don't know what it is, so therefore they tell people that it's either all in their head or they're perfectly fine, because a lot of these joint issues and all the joint pain can't be seen on an MRI or a CAT scan or anything like that because it's a tissue issue. Since a lot of people don't know about Ehlers-Danlos Syndrome, there's a lot of misconceptions about it. I'm going to read a few of my favorite examples of these misconceptions from the Disjointed book that I was talking about earlier. These misconceptions are about hEDS, but I feel like some of them or all of them could be applied to the other subtypes of EDS as well. The first one says that hEDS can be cured with lifestyle changes. However, hEDS itself cannot be cured, but there are many treatments and interventions that can be taken to manage these symptoms. The second one is that you're faking it, which is a very popular one since these EDS symptoms cannot be seen with tests. A lot of doctors tell people that their EDS symptoms are in their head, which can be very emotionally damaging and traumatizing for patients that are in so much pain, but they're just trying to get answered. Another one is that you're not trying very hard. hEDS patients have to put significantly much more work and effort into doing everyday things. They also have to deal with fatigue, pain, and brain fog in the process. This is a very popular one. But you look so healthy! hEDS is an invisible disorder, but it can have a significant impact on the quality of life. This is another issue with EDS, is that it's an invisible disorder. You can look at me and say that I look healthy right now, but that doesn't reflect how I feel on the inside. It doesn't show that I have POTS, which means my heart rate gets highly elevated whenever I stand up and my blood pressure drops, which leads to lightheadedness and fainting. You can't see that my stomach is partially paralyzed by looking at me right now. You can't tell that I deal with dysautonomia, with asthma, PTSD, anxiety, and so much more that I'm not going to get into right now. I'm not going to make this a rant. There is still much needed research and awareness for EDS. It does not have a cure. I added more links to the description below so that you all can continue to learn about this if you wish to do so. Bye! Thank you all for watching! Bella, say bye! It's okay. I'm sorry for waking you up. Oh my gosh. She's looking at me like she wants to kill me right now.